The Intersecting Disability and Race Attitudes of Healthcare Professionals. This video talks about a research project where we looked at the attitudes of healthcare professionals, like doctors and nurses. If you missed the first two videos in this series about what intersectionality and attitudes mean, and about our new tool, called the IAT, you should watch those videos first, so it's easier to understand this video. Healthcare professionals can change disabled people's lives. For example, when doctors do a good job listening to you, they treat you better and your health is better. But when doctors don't understand what disabled people want and need, their health is not good. So it's important to know how healthcare professionals think about things, to make sure they're not treating people badly. For example, past research has found that most healthcare professionals have negative implicit attitudes about disability. But most of the time healthcare professionals don't even realize they have bad attitudes about disability. There is research about healthcare professionals' implicit attitudes towards disability. There is also research about how they feel about people of color. But there's not a lot of research about how they think when disability and race are together. Discrimination can work differently when we have many identities. For example, even though they both have disabilities, black disabled people may be treated differently than white disabled people. This is called intersectionality. It means that people are discriminated against because of all of the parts of who they are, not just one part. In this research project, we wanted to find out more about how healthcare professionals think about disability and race. We had 784 healthcare professionals take the Intersecting Disability and Race Implicit Association Test, called the IAT for short. While taking the IAT, we had healthcare professionals choose where words and pictures go. To find out their implicit attitudes, we looked at how fast or slow they made these choices. For example, when making choices, people with negative attitudes are faster with disabled white people and slower with disabled people of color. Past research has found that most people have negative attitudes about disability. Research has also found that most people have negative attitudes about people of color. In this study, we found that healthcare professionals had negative attitudes, but it was different when you looked at both disability and race together. We found that healthcare professionals liked non-disabled white people the most, then disabled white people, then disabled people of color, and then non-disabled people of color the least. This was really different from what they thought their attitudes were. They thought they liked disabled people of color the most, and then non-disabled people of color, and disabled white people next, and then non-disabled white people the least. But when we looked at their implicit attitudes, healthcare professionals liked non-disabled white people, and disabled white people the most. We also found that some healthcare professionals had different implicit attitudes than other healthcare professionals. For example, healthcare professionals who worked in personal care, like direct support professionals, had better attitudes about disabled people of color. Healthcare professionals that were Asian, women, and younger, had better attitudes about disabled people of color. But there were some healthcare professionals whose attitudes were not as good. For example, healthcare professionals who had high school diplomas had worse attitudes about disabled people of color than healthcare professionals who had graduate degrees, which means they graduated college and then did more school. In this research study, we found that a lot of healthcare professionals have negative attitudes, especially about non-disabled and disabled people of color. This is important because the more we know about how things work, the better job we can do at fixing things. Now that we know a little more about how healthcare professionals think about disability and race, we can do more research. For example, we can see if negative attitudes cause people to be less healthy. Now that we know this, we can also try to figure out how to make healthcare professionals' attitudes better. Everyone deserves good healthcare. We have to make healthcare professionals' attitudes better to make sure this happens. This video was created by the Council on Quality and Leadership. This project was funded by the WITH Foundation.